Yeah.
So how do you go about healing your thyroid? Is there a specific diet you recommend or for healing these PCOS thyroid problems and healing your thyroid in general?
Sure. I mean, anything that is an inflammatory disease, anything that is a chronic disease that it attaches inflammation to it, we should be trying to eat as clean as possible and following an anti-inflammatory diet. Of course, this means many things for different people, but in general, from my experience and from the research that I've done, we want to kind of decrease a lot of the grains. For a lot of people, that means completely avoiding gluten, which is the protein found in wheat. Gluten has been highly correlated with autoimmune disease in general. So just avoiding gluten, especially if you found out after being diagnosed for PCOS that you have an autoimmune thyroid condition, you want to make sure that you're getting rid of that first. The other thing to kind of get rid of is conventional dairy. Conventional dairy, because a lot of it is not from cows that are grass-fed and pasture-raised, and they're being given these genetically modified feeds, which increases their inflammation, which then increases our inflammation. We should kind of be avoiding that. And in general, in the beginning, when you're doing, I usually recommend the 1 to 3 month elimination diet for a lot of my patients. In general, we should be avoiding dairy because not only are a lot of people lactose intolerant, which is the sugar found in dairy products, but these dairy products also contain casein, which is the protein found in dairy products, which can act similarly in the body like gluten. So we want to make sure that we're just avoiding these things in general in the beginning of our elimination process. And of course, another huge one is sugar. We are so dependent on sugar, it's kind of disgusting. 200 years ago, the average person had about 20 teaspoons of sugar a year, whereas our kids today are having 35 teaspoons of sugar a day. So I'm convinced that sugar is just as toxic for you as any drug, any illegal drug, I should say. So we should really be trying to avoid a processed-based diet and getting rid of all the sugars, getting rid of all the additives. It's important to say here that a lot of the additives and a lot of the way we're growing our foods, there are more hormones in our foods, and we're seeing these fake estrogens get into our foods, and if we're eating them, we see a lot of hormonal imbalance, not only in women but also in men. A lot of men are getting female-like symptoms because of all these high estrogens in the food supply. So, kind of choosing to opt for as organic as possible, choosing grass-fed, pasture-raised meats, free-range chickens, wild-caught fish, as natural as possible is the key to healing. Now, there's different variations of how to eat for this. And one thing that I've learned by doing this job for almost 20 years is that everybody is different. And that's why I think it's so important that you work with a trained professional on your diet, because what works for you is not going to work for everybody else, and vice versa. And that's why it's so important to really scrutinize over yourself and what you are able to tolerate on your journey, rather than what you're reading in a million articles, or what your friend is doing, or what your aunt is doing, or whatever. It's very important to find what works for you. So that's another kind of thing that you can choose. For example, if you have PCOS and you found out that you have an autoimmune disease that attacks the thyroid, you can also opt to follow an autoimmune protocol. And what the autoimmune protocol basically is another version of an elimination diet. The elimination diet is basically you take out grains, dairy, legumes, beans, which stings for a lot of Greeks, but okay. You take out nuts and seeds. You take out some adaptogenic herbs like ashwagandha. You take out a lot of, what's the other? I'm forgetting one more thing. But in general, you take out all these foods as an elimination version, and you start to reintroduce all these foods one at a time to see what bothers you. And it's important to note that if you reintroduce a certain food, let's say you start putting almonds back into your diet, if you get a reaction from that, it doesn't mean that you will not be able to tolerate almonds in the future, because you just want to give time for your intestines to regrow and heal ultimately. And we see a lot of reversal. I've seen a lot of reversal in my own patients that are on the autoimmune protocol with their own PCOS symptoms, like their insulin resistance is reversed, they have a lot more, their hormone balance is better, a lot of the lab work that they do is better. So it just shows that what a huge impact what you're putting in your mouth is making on your body. Yeah. So yeah, there's lots of different routes you can go through. There's lots of things you can do. But in general, if there was one piece of advice that I would give people that are trying to take their health back into their own hands, is to eat eat a diet from real food. And there's a huge disconnect now, like we're all used to buying stuff from boxes. And a good rule of thumb is if your grandparents or great-grandparents did not eat this stuff, you should not either.
Yeah, so. I agree. Definitely. Like food really is medicine. It's so powerful. Nutrition, a lot of people don't think nutrition can actually heal. I remember I'd done this one little live stream and I mentioned how nutrition really is important. And people were like, does it? Are you telling the truth? Like, is it really? And I'm just like, yeah, food really is medicine. Like, you hear it a lot, but people still don't really believe it. And it's just, we have to change our mindset towards how important what we eat actually, actually makes a difference in your body.
Of course, it just kind of shows as well how brainwashed we are to thinking that, you know, our medicine lies in a pill, which again can help, and of course can help. But what about the rest of the stuff? So basically, if I'm sleeping bad, not exercising, eating all processed foods, these things don't matter? Of course they matter. Exactly. They're the foundation of what you're trying to do for your health.
Yeah. So when you're talking about pills and medication, would you say there's any supplements that could help your thyroid and PCOS?
Sure, there's lots. And a lot of people ask me too, well, shouldn't we be getting all our food, all our supplements, all our vitamins and minerals from food? And I say to them, well, if you consider that if you have one day of stress, that your nutrient requirements increase by about 300% for one day, and most thyroid patients have a lot of digestive issues too. I don't think you're going to initially get all the supplements all the vitamins and minerals that you're going to need from your diet. Eventually, that's what I would like to happen. I want the diet to take over and to supply all that nutrient density, because nature is a wonderful thing. God created the planet in a way that, you know, it just makes sense. So you have your food, and the food has the vitamins and minerals are mixed together in such a way that your body just recognizes it and understands it and knows how to absorb it and do what it's going to do with those nutrients. But in the beginning, what we want is to kind of help the person feel better a little bit faster so that they're encouraged to keep going. So there's many different supplements that can help your underactive thyroid. And the first one that's highly important is selenium. Selenium is a mineral that actually helps decrease your antibodies. There's research that shows that after taking about 200 to 400 micrograms of selenium after 6 weeks to 2 months, that it could reduce your antibodies in half. So selenium is a huge one. It's also very important to help the body transfer T4, the storage form of thyroid hormone, into T3, the active form of thyroid hormone. Another very important one is zinc. Zinc also helps the T4 to T3 conversion. It's also very important mineral for hair. A lot of women that have hair loss, when they add zinc back into their diet, they can actually see kind of like their hair stops falling out. And also very important to note is that if we're taking a lot of zinc, it's also important to add copper, because if you take too much zinc, the copper could go out of whack. And if you take too much copper, the zinc could go out of whack. So these two kind of work together. And a good rule of thumb is that for every 15 milligrams of zinc that we're taking, we should be taking about 1.5 milligrams of copper. Okay, so it helps to do that balance. In fact, copper is kind of so important that a lot of the time they use something called the selenium to copper ratio to understand if you're having thyroid hormone resistance. In other words, your cells aren't responding to the thyroid hormone. So yeah, taking a little bit of zinc and a little bit of copper is very important. Another adaptogenic herb that can probably help a lot of people with PCOS too to regulate their symptoms. What does adaptogenic mean? It basically means if, for example, your estrogen is too high and your progesterone is too low, that adaptogenic herb comes in and it balances them so that they're where they should be. And one of these ones that I use quite often with my clients and we see great results is called maca, which is a tube root. And it does wonders. I mean, I typically start people off on 2 grams on their first day of their period. And we see a lot of people reporting back and they're like, I didn't have all the symptoms associated with my period that I usually have. The cycle got cut in half. Instead of, waiting 2 months to get my period, I got it in a month. So that's kind of a great one to kind of regulate all those hormones working together. Other ones, another great one for menstrual cycle and for the thyroid and for everybody really, because we're all deficient because of our food system lately, is magnesium. Magnesium is one of these minerals that is just like the wonder drug for everything. It also helps with a lot of issues like constipation, which is common with hypothyroidism because, again, things work together. Your intestines need enough thyroid hormone to move fast enough. So magnesium can help with that, especially one called magnesium citrate. And taking about anywhere from 400 to 1,000 milligrams of magnesium every night before you go to sleep helps the intestine to work better and helps you to sleep better. So I think these are kind of the main ones in terms of supplements. One more to perhaps consider is that because with Hashimoto's patients, we see a lot of, they do not have enough stomach acid and therefore do not break their food down properly before it gets digested properly. We see a lot of B12 deficiency, and vitamin B12 is vital for nerve health. So a lot of the times those symptoms will appear as tingling in your extremities, in your head, in your hands, in your feet. And a lot of the time, because we cannot absorb B12 properly, it's important to get a supplement that is sublingual under the tongue, and you allow it to melt in your mouth to get absorbed that way. These are basically the basics for your thyroid. There's definitely a lot more, and it's a lot more in depth because, again, we look at the patient as a whole. We're going to ask about the intestinal health. We're going to ask about their hormonal health. We're going to ask about their sleeping habits, their exercise habits, stress management habits. All these things count when you're looking at how to heal the thyroid and how to regain hormonal balance.
Yeah, that's great. So that last bit you touched on about sleep and exercise, stress management. What kind of lifestyle changes does someone who's looking to heal need to start implementing?
Well, I think it's true of the times that we're so caught up in the rat race, let's say, that we are not really taking the time to do what us human beings were programmed to do. One very important part is sleep. I mean, we have been programmed since the beginning of the earth, like every cell on this earth, every organism is in tune with the light and dark cycles of the earth. So that means that our hormones are programmed to respond to the light and respond to the dark. But because of technology, and because of busy schedules and whatnot, we are just completely disconnected from this cycle. And so, for example, I had mentioned before that when you wake up in the morning, you have higher cortisol levels. So when your body senses light from outside, it starts stimulation of cortisol to wake you up. When your body senses that the light has gone away, it signals the body to produce melatonin, which is your sleep hormone, to start sleeping better. So a lot of my clients, one of the biggest questions I ask is, how's your sleep? And I would say about 80% say not good. Either they don't sleep enough or they don't sleep well. They keep waking up throughout the night. So doing things to go back to nature will help your sleep pattern a lot. So for example, working on your laptop or looking at your phone right before you go to sleep is not a good idea, because your body translates that light as, okay, time to produce cortisol, wake up. So your sleep pattern is disrupted. So avoiding that for perhaps an hour before you go to bed, and going into doing things that kind of relax you and put you in the mood for bedtime, taking a nice bath, perhaps with magnesium salts, that helps you to relax, dimming the lights in your room, just putting a little bit of light, so maybe perhaps you can read something, and just giving signals to your body that it's time to sleep. And although these things may sound like common sense, unfortunately, common sense is not so common anymore. So we have to kind of remind ourselves of those things, that, it's time to go back to nature and back to how we were meant to be living. So once you start improving your sleep patterns, you'll see that you'll be sleeping better throughout the night. And of course, diet has a lot to do with this too. If you're eating a lot of sugar, if you're eating a lot of processed foods, your sleep pattern is again interrupted, because it's just producing that stress hormone of cortisol. So again, an anti-inflammatory diet is going to help your sleep pattern as well. And in turn, when you're not sleeping well enough, you signal hormones that want sugar. So you crave bad stuff and you eat more sugar, you eat more processed food. So everything is intertwined and everything creates a vicious cycle, or everything can create a good cycle as well. So for example, you eat well, you do your relaxation method before you go to bed, you turn off the lights, you sleep better. Because you're well rested, you eat better foods, and it just creates a much better environment for what's going on inside of your body. Other lifestyle changes. I see from my experience that above diet, I think the biggest lifestyle change to make is stress management, is reducing your stress. And a lot of people say, yeah, okay, Tina, better, easier said than done. And of course, it's easier said than done. However, when it comes to our health, I believe that if we put it as a priority and to do things that make us happy in our lives and to reduce stress, we're going to see such a huge improvement in how we're feeling. Since PCOS is targeted towards women, I think it's important to say this to women. We have to learn to say no. A lot of us, we just say yes to everything. And women are such capable beings. Like, we multitask, we are in charge of so many different things throughout, so many things going on throughout the day that we just explode with how many things that are going on. But we need to learn to say no, and we need to start saying yes to ourselves. And in the beginning, it's very challenging, because I was a huge yes person. And in the beginning, I was like, no. But after a while, you kind of start gaining confidence and you say, well, no, I'm not comfortable with doing that. So, maybe perhaps we can try this instead. So learning to say no. In the beginning, it may be baby steps, like learning to say no to your child that wants to eat 20 chocolates, just giving an extreme example. But it can be baby steps of learning to say no. The other thing we can do for stress management is just taking the time to breathe. I mean, a lot of people say, meditate, pray, do things that are calming to the body, which are just as important. But I think another baby step towards that is learning to breathe. We have disconnected with feeling oxygen enter our bodies. So what you can actually do is breathe in for 3 seconds and breathe out for 5 seconds, and do this whenever is needed throughout the day. And you'll see that your brain kind of reboots and you start to calm down. The next level to that is kind of looking at meditation programs, or if you believe in God, praying. I mean, there's even research that people that pray have less disease because it's a form of meditation. So there's apps now that you can download that will help you with guided meditation. In the beginning, you're going to feel really weird. You're going to be like, I can't do this. My brain is constantly moving. But after a while, basically practicing meditation is like doing bicep curls for your arms, In the beginning, it's going to feel weird. You're going to be really sore. You're not going to want to do it anymore. But every time you kind of stop thinking for a moment, that's like doing a bicep curl for your brain, because you shut off your brain and you shut off, you put your body into a state of relaxation. Now, all of us as animals, we should be having a certain amount of stress in our lives. We're programmed to go, 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 but we're also programmed to rest. But most of us are going, 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 and we keep on going. There's no time for rest. So it's just as important to rest as it is to keep going. Another important lifestyle factor is definitely movement, exercise. And again, just like nutrition is specialized for the individual, so should the exercise program. I'm not an expert in exercise, but there is some research with autoimmune disease showing that if you overdo it with exercise, and that overdoing it, the definition is defined differently for everybody. But if you overdo it with exercise, you can actually trigger an autoimmune attack. And also being completely sedentary also can trigger an autoimmune attack. So it's very important to find exercises that just resonate well with you. For me, I used to love running, but it was just not doing a good thing for me at all. So I've kind of transitioned into more walking outside in nature, sometimes Pilates, sometimes yoga, things that kind of relax me, but at the same time do some strength training for my body. And again, it's working with a professional that knows about these things that's going to help to guide you in your journey towards how you can implement activity into your life. Everybody's different. So yeah, we've said sleep, we've said stress management, and we've said exercise. I think that's important. I think another one that like we're in charge of, and this is why people like Despy and I are doing these interviews, and I do what I do, is to get the message out there in terms of that you can be a huge advocate for your health. And by learning more, you can be more educated in the kind of tests and questions that you're asking of your doctors. And you can say it to them in a nice way. I mean, a lot of the time what I would do is kind of bring books written by professional doctors that are talking about a more functional medicine scope. And I would kind of show them studies and say, can we try this? Like there's some research on this, or can we do this a little bit differently? And you are the people that are going to be, all of us are the ones that are going to make a loud enough noise to have, doctors change the way they do things, have a more open mind towards medicine, have a more open mind towards how people are being helped. And I keep saying doctors, but it's not just doctors. It's registered dietitians, it's nurses, it's physiotherapists, it's, everybody that's involved in helping people with their health. To have a more well-rounded approach to people and to treat people as a human being, that, to ask about their psychology, to ask about their, what's going on in their lives, to ask about, how they're functioning on a daily basis. Not just, okay, let's focus on the nutrition, not just, okay, let's go and exercise, not just, okay, here's a pill and goodbye. So yeah, we really need to make a movement, and it's up to all of you. We really need to make a movement to say that, listen, we have rights, we want our health back, and we want to work together with you. We don't want to go against you, we want to work together to feel better. And I think that's a huge lifestyle factor, having a voice and not being afraid to use it.